Welcome to this month's monthly education. In the words of the great Bill Davis, we're at the Pride of the East Side, Care Flight 2, also known as the home of the Purple Cobras. If you know, you know. This month we're going to be covering balloon pumps, we're going to be covering Impellas. We're going to go over how to manage each of those specialty devices. We're going to go over some of the logistics of loading those devices into the aircraft, making sure that we keep our lines out of the way. We're also going to cover how to put the brackets in and make sure that we're securing these devices properly. That's it, man.
All right, hello everybody. We are in Care Flight 2. We are in the 429, and we're going to be talking about balloon pumps. The noise that you hear is actually this balloon pump right here. We actually have the balloon pump trainer right here, and we have it going so that everyone can see kind of what happens. I want to explain a little bit about what happens with balloon pumps and what it does, so that we have a better understanding of what we're transporting. So this is the balloon pump. As you can see, the balloon is inflating and deflating. This is full of helium, so we'll go through later on talking about how to refill helium, transport considerations, all those types of things. But I just wanted to see everyone to see this is kind of what happens when the balloon is going on. You can hear the noise in the background, and you hear the pause. That's normal. So if that happens to you and it starts back up, that's okay. It's actually doing self-checks, self-correcting, and everything like that. The balloon pump is constantly going back and forth, trying to figure out what trigger to use, which we'll talk about later, and how to best basically trigger off of this patient that you've got. So once again, this is the balloon. So you can see it's going in here. Where the balloon gets inserted, it's inserted through the groin. So when it gets inserted through the groin, it's sutured in right here. So what you're going to see for the most part is about this much sticking out, and you're going to see this little piece that's covered up by a sterile dressing, and you'll see it sutured in. One of the things we need to make sure of is that we're looking at these dressings and making sure that there's no bleeding, that this is sutured in correctly, that nothing is pulled out. You'll see that there's a sterile sleeve right here. This right here is so that in case they do need to move it, they can move it. Obviously, we don't do that in transport, but this is what happens with it. There's another part right here, excuse the noise. There's another part right here that's basically where you can inflate and deflate, or even put a trigger on for your art line in case you need to do it. So once again, this goes into the groin. It sits. So if I go right here, it's going to sit in your aorta, and it's going to sit above your superior mesenteric artery, basically above the renal arteries, and it's going to sit below the subclavian on the aortic arch. One of the things that happens with balloon pumps, it's considered counterpulsation therapy. What that means is that this is actually inflating right at the beginning of diastole, which is when the aortic valve closes, and it's actually deflating when the aortic valve opens during systole. So what that means is some people like to say that it's kind of decreasing and offloading the left ventricle, but it's really not. What happens with this is right when it inflates, you're going to see this backwards or retrograde blood flow that comes down to right where the aortic valve closes, where your coronary arteries perfuse. So it's going to push more blood flow and then create more blood flow to the coronary arteries and perfuse them better. So in essence, this balloon right here is constantly inflating and deflating based on the cardiac cycle. Pretty important. Another couple of things that you have is, if you see the very tip of this right here, that is radio opaque. So when they have this inserted, you're going to want to, when the doctors go in and look at the x-rays, they're going to make sure that this distal tip is not up past typically the third intercostal space. For some people, it's a little bit different. These balloons have different sizes, 30, 40, 50, and basically what that means is just 30, 40, and 50 cc's. So this is basically depending on the size of the patient, because you know, the taller you are, the longer your aorta is, and sometimes the bigger this balloon needs to be, or it needs to be a little bit longer in order to inflate. So that's the balloon pump. that's how it works. A couple of different things that you need to think about consideration-wise is if you're transporting a patient and you are looking at this right here, this is where the balloon comes down. So you can see where it's inflating right here. You follow this down into this little area right here. This is hooked up to the machine where the helium is. So as you can see right here, the helium's right here. If you happen to see rust-colored flakes in this tube, or any type of like brownish color, then that's going to mean that this balloon right here is ruptured. So if you see that, then you're going to want the balloon to be turned off. You do not want to introduce air. You don't want to introduce anything else into it, because if you go to inflate this to try to inflate the balloon, you're basically introducing regular air into the aorta, and that's not something that we necessarily want to do. So if you see rust-colored flakes in here, that just means that the balloon's ruptured. Turn the balloon pump off, and you're going to treat the patient accordingly. The big thing to remember about balloon pumps is they're not mechanical circulatory save the patient devices. They're mechanical circulatory assist devices. So when these devices, just like the balloon pump, the Impella, when they fail, then it's something that we need to be concerned about, but for the most part, we just turn it off, treat the patient. Maybe add some more pressors, maybe do what we need to do to take care of this patient, okay? So another thing is, if this does, let's say the balloon pump itself just loses power, shuts off, and stops working, and doesn't come back after it stops its little pause for a second, then you're going to want to, based on CareFlight policy, you're going to want to inflate this balloon at least once every 30 minutes. Basically, you're going to take your 60 cc syringe, you're going to blow the balloon up, and you're going to deflate the balloon, making sure. One of the big things is, if you can imagine, this right here is inside the body. If it stays deflated for any period of time, the body's going to look at it and go, it's foreign, and we need to clot. So they're going to potentially have clots that are developing on this. So you'll, based on our protocols and our procedures, once every 30 minutes. All right. As far as this balloon pump goes right here, I'm just going to set this right here and let it just keep running in the background. One of the things that you want to think about is documentation. When it comes to documentation, we actually have a balloon pump check sheet on ImageTrend, so make sure you're filling those out. Some of the big things to consider are going to be documentation of the site itself, where it is on the body, what the site looks like, what types of things you're seeing. Is it clean and dry? Does it have a little bit of oozing? Where is it at measurement wise? And what type of balloon it is? Is it what size the balloon is? And if they had, what type of conformation they used. Most of the time you're not going to be able to necessarily ask for the x-ray. Sometimes they'll have it right available for you, but if it is a concern and there's something that's going on, then you want to make sure that you kind of look at that. So you want to document distal pulses, making sure you have those distal pulses. Think about this balloon right here, where it sits and what it's doing. Remember I said it needs to be over the up above the artery. So another consideration is urine output. So did they have urine output? How much urine output? Is it decreasing during the time that we're transporting them? Because if it slides down, if that balloon slides down, then it can block the renal artery and therefore cause lack of perfusion to the kidneys. Same thing as if you put your pulse ox and it migrates up, and you have your pulse ox on your right hand, and you start losing pulses over here to the right, then that means that it's now migrated up enough to where it's blocking off the artery that supplies the brachiocephalic, the right subclavian, and then ultimately the rest of the right side. So making sure that we have those types of things situated and in place so that we can document those as appropriate. Do you have a patient, let's say you have a patient that does not have a patent circle of Willis, you can have, if the balloon migrates up enough and it starts to clot off that left artery, because remember we have our carotids that come up right here like this. If it goes and blocks off that carotid artery and that person doesn't have a patent circle Willis, meaning they don't have the ability to have that collateral circulation, you can start to see stroke-like symptoms if it migrates. So a little bit niche, but interesting information to put in there. I think that's pretty much it for the balloon pump as far as the beginning parts. Later on, we're going to show you transport considerations. We're going to show you all different types of things to think about when it comes to balloon pumps. All right. Before we can take a balloon pump call, we need to make sure we do our pre-op checks, and we need to make sure our bag is fully stocked and everything. So I'm going to go ahead and turn the balloon pump on right here with this green button, making sure that, because it takes a minute to warm up while we go through the bag. All right. So here, Dallas, you're going to see this bag right here. This is the go bag that you can take with you. In the back, very, very back, it has a checklist. So on the checklist, it's kind of beat up, but it has all different types of things that you can do. It tells you where everything is and what sizes, if you end up having to plug things in. So this is really pretty much a quick reference for those who don't do balloon pumps a lot. Inside the bag, you're going to find in the very, very back, you're going to find some extra tubings for the helium. You're going to find that's just the balloon pump. You're going to find Arvin setup, you're going to find straps, extra helium in the bottom. You're also going to find a plug, an inverter, things like that, so you can use to actually plug this in. In the front, you're going to find extra cords, extra cables, so these are the cables that you use. You're also going to find an extra art line setup. And then in a later lecture, we're going to show you a little bit about how to splice in. These are adapters that adapt to different types of pumps. On the side, you also have syringes, you have extra manifolds, and this is so that if the balloon pump fails, you can put a stopcock on and you can inflate and deflate the balloon manually. On the other side, just a pressure bag, because we'll need that. If you don't have a fiber optic cable, then you're going to be going off of art line, so make sure you have a pressure bag, art line setup, art line clip, everything. All right, so that's the bag. All right, so we're going to turn our attention over here to the balloon pump. It turned on, which is great. One of the things we want to do is I'm going to turn this around. On the back, you can see that the battery is charging, so it is charging. Notice this helium, this doesn't work. So it's going to show 0, so we'll show you kind of where to find that on the actual balloon pump. On the front, this is where you would look here. So the helium, it will show low. So when I unplug it to do the test to make sure it works off the battery, I'll show you what that is. Down on the bottom, you want to look at the bottom, making sure that these are the batteries here. So these batteries will come out when you pop them out. So you just turn that this way, this battery comes out, turn it the other way, and the other battery comes out. All right, so down here you can see a lock. There's a handle here. That's going to release it. Pull that out. That'll come out like that. Once you pull this out, this is the part where the monitor will hook on. Show you that later. Now you can see the helium shows and it's up. So we want to make sure we do all these pre-op checks. Make sure that it's working. It's working off of battery power. The batteries are good. Everything is charging. Everything is working, so that we can mark that on the list up in the room, and you're good to go to take a call. All right, so this is the balloon pump mount. Just going to show you really quickly how to put this in. So as you can see on the bottom, I'm going to show you, there's these 2 little feet that are right here. Or actually, there's 4 feet, and then there's 2 little locks. That goes with these right here, okay? So when we put this balloon pump in, we're going to kind of go here. We want it to go into these little spots, those little feet that I showed you go in. We're going to slide it up pretty much even with the door. The reason why we want to do that is because think about where the balloon pump is on the patient. It's going to be in the groin. So we want to make sure that we have as much slack as possible and not make those cables tight. So next thing we're going to do is once we have it in here, we're going to turn this and get it kind of at the side. Take that. And then now it's locked in. Same thing here. Those turn and click in. And then I usually pull it like that, so that way it's locked in.
All right, so let's say that we've arrived now at a cath lab or somewhere in a sending facility sending out a balloon pump. Let's pretend for the sake of this video that this right here is the distal end of the balloon connected to the facility's balloon pump. We are not going to be taking their balloon with them or their balloon pump with us, so we're going to be having to use ours and transfer everything over. Now, that is the only thing that we are going to be keeping from them is the actual balloon itself. All of the cables and all the redundancy that goes along with it, we're going to have to use our own. So you saw everything already that's in this bag. We're going to need quite a few things out of it. We're going to need to confirm whether the facility has oval or square pressure tubing for the art line and for the art line off the balloon pump. Sometimes you will arrive on patients that have a normal art line like you're used to seeing in one of the radials or the brachials up here in the arms. You can transduce that to your monitor, or if you don't have that, there's also going to be a port at the groin insertion site for the balloon for you to connect to as well. The name of the game with balloon pumps is redundancy. There's going to be double of everything to include extra EKG lines. So first things first, we're going to get this patient on the balloon pump EKG, and then they would also be put on our monitor's EKG on the Zoll as well. The balloon pump, as you already know, triggers off of a few different things, or has the option to trigger off of a few different things. It can trigger off of the EKG, which we're attaching right now. It can trigger off of the art line that you have in one of the radials, if you have one of those. Or it can trigger off of the art line that is inserted into that groin site right in here, and I'll show you that real fast what that looks like. So it's going to be this port right here is where you would connect your pressure tubing to. Again, the sending facility would already have that attached, have something running here. So you would just take their pressure tubing with the oval cable and just switch it over to yours. So in theory, the balloon pump only needs one of these three things, either an EKG, an art line, or a fiber optic cable, which I'll show you in a minute, to operate. But we want to make sure we have all three connected if available. Not every balloon pump is going to have a fiber optic like this one doesn't. But you want to make sure you have as many things connected as possible so that if one of them becomes problematic, the balloon pump will automatically switch itself over to triggering off of a different source. So we have the EKG attached right here to the green. Next up, we're going to take our art line. Say it's connected to the patient. We've already connected and zeroed and done all that jazz. We're going to come down in here, and we're going to plug it into the red. Color-coded, made nice and simple for you. And this right here is an example of the square pressure tubing connection rather than the oval. Again, you're just going to have to confirm what the facility has, but we have both options available in this bag as well as in our Zoll monitor. Connect this up. Again, it's going to connect your pressure tubing right here, and we'll lay it across, and we're good to go. In the event that the sending facility has not a Mackay balloon pump, but rather an Arrow balloon pump, we're going to need to use these adapters to be able to actually connect this tubing right here, their tubing, to ours, and make that adapter work, and we will show you guys that later. So while the sending facility's balloon pump is still running, we have all of our cables connected. I'm going to attach a training box now real fast to show you what it's going to look like on our pump. You would then be able to see on your monitor down here both an EKG tracing and an art line tracing from whichever source you selected. Once you confirm that you have both these sources running and functioning, you need to zero your art line just like you would on any other art line monitoring system, right? So to zero it on the balloon pump, there's a zero pressure button right here. You're going to open up the stopcock on the pressure tubing just like you would with any other system. You're going to press zero pressure right here. You're going to hold it for 2 seconds. And it's going to show you zero incomplete right here across the system. You're going to close your stopcock, so you get your art line waveform back, and now you're actually going to have a numeric reading showing you that you do have a good art line setup and connection. With all of this done, we are set up and good to go, and we're ready to swap the balloon tubing itself from the sending facility to ours. The process for that is very, very simple. Assuming, of course, it's a Mackay to Mackay connection, you simply disconnect it from their pump over here. You're going to come down and just plug it right in over here. Connects right there, nice and simple. And then you're going to come up to the screen, press the start button, and you're going to let it do its thing. It's going to start doing some tests, kind of like the vent does some test breaths. You're going to let it do its thing, fill up the balloon. It's going to take probably 10 to 20 seconds before you hear it start pumping. What you're seeing right here, now this blue waveform that's popped up for us is showing us the pressure inside of the balloon, confirming that it is inflating and deflating. These are still test inflations. These right here are the first actual inflations, and now you can see in here that it is functioning and running appropriately. So now that we're up and running, you're going to see that the McKay defaults to this automatic operation mode right here, where it does everything for you, your timing, and it's going to default to a frequency of 1 to 1. To be able to interpret your timing waveforms, you do have to be in a 1 to 2 mode right here. So switch that over, and you hear and you can see that it is now only inflating and deflating the balloon on every other cycle of the EKG or the art line. Just to confirm what you're triggering off of right now, it's always going to show you in the top right corner. Right now it says the trigger is the ECG, or the EKG, and it is triggering based off the QRS complexes of the patient. I'm going to put this back into 1 to 1 real fast, and I want to show you what happens and what the purpose of having all this redundancy is. Especially when we're moving, we're going to have a lot of noisy EKG signals and a lot of artifact occur. So let's say we have that happen, and you see now that our EKG is very noisy, a lot of artifact messing up. You saw that for a moment, all of our balloon waveforms down here got really weird and the balloon pump didn't know what to do. Luckily, it's smart, and we have all of our redundancy set up between the art line and the EKG. So it automatically switched itself over to triggering off of pressure instead. And even though our EKG waveform is noisy with a lot of artifact, it's still triggering appropriately with every single cycle with appropriate timing based off that art line. Once you stop moving the patient and get everything settled down, your waveform, your EKG comes back. It's not going to immediately switch back over to EKG triggers. It's going to give it some time to make sure that it's a reliable source before it switches back to that. The balloon pump will most of the time prefer to trigger off of EKGs, but patients with certain dysrhythmias or tachycardias over about a range of 130 to 140 are suboptimal, if you will, for triggering the balloon pump. And even if you have a perfectly clean waveform on your EKG without any artifact, sometimes you will see that it is still going to trigger off of pressure simply because the rhythm is too difficult to interpret. So if you're lucky and the sending facility placed a balloon pump with a fiber optic line that matches the McKay system, I'll show you what that looks like right here with a different balloon setup. It is going to be this orange line that you have right here. So in these lucky cases where you do have this option, you now have 3 different opportunities for redundancy. This very simply is going to plug in right down here. It's going to slot into here. And it can be pretty challenging to get it to seat just right. You're going to feel like you're going to break it or like it's not sitting right. But eventually you find the right angle, you pop it right in. Obviously this is not going to work because we're inflating the balloon that's on the patient, not this balloon right here. But this is actually the balloon's preferred art line source if it's available. This is something that does not require zeroing like I showed you before, or a pressure tubing setup or anything like that. It is a fiber optic sensor that sits at the very tip of the balloon inside the aortic arch, and it is sensing blood flow coming out of the heart, and that is telling it when to trigger. So now, in the case that we do have this fiber optic, you have your orange, your green, and your red all set up and ready to go. This blue you will not have. This is just how I have my trainer box connected here. And your balloon finally is connected right in here. You're good to go. In the event that in transport, something happens, you pull your line a little too tight and this pops out, just like this, you're going to hear it start alarming. You're going to see the screen right here with my balloon pressure waveform is flat, meaning nothing is inflating. All you have to do is take this tubing and plug it back in. All right. The balloon is going to have to go through the same exact thing that happened before. You're going to hit start, and it's going to have to go through all of its tests. It's 15 to 30 seconds of testing itself, reinflating that balloon and finding the right pressures. You'll also notice over here that as this happens, your helium levels are dropping because every time that happens, you're losing a little bit of helium. The normal balloon pump cycle does not waste helium. It reuses the same volume of gas with every inflation and deflation to conserve gas. The only time you're going to lose helium is when you have disconnects like this, and that's why we want to try to avoid it. But that's also why we carry the extra helium tank and make sure we have the option to refill back here if necessary. Now you see, 15, 30 seconds later, it's back up and running. Everything is good to go. All right, so now you have your balloon pump completely set up with your 2 to 3 levels of redundancy. We are inflating and deflating on ours. We can take the sending facility's balloon pump out of the way. We are ready to roll with ours, start walking towards the helicopter, load them in, which is something that we'll show you the process of here in just a moment.
All right, so here we're up on the helipad at Methodist Dallas. We've got the balloon pump hooked up to a mannequin like we would normally have it. We have all the equipment as close to practical as what we would have. We're going to show you the process of loading the balloon pump into the 429 and some of the tips and tricks that you can use to help you kind of get that process done. One of the things that we do have is there's only 2 of us up here. Typically, we would like to have a third person, and that's really just to manage these lines. As you'll notice, when we start to move this patient, these lines, which are connected to the balloon pump and then connected to the actual balloon here and connected to the balloon pump, are really important. We've already talked about this line right here, but this is where the helium comes in. And so this right here is really easy to pop out. I don't have the balloon pump on so that we don't lose the helium, but this right here does not have a connector. So what we need to do is make sure that someone is holding this so that this doesn't just pop out like that. We only have about 6 purges before the helium is out. So we're just going to go through the process of loading and show you kind of how this would work, how it goes into the mount, and some of the things that we're going to do as we're kind of getting the patient in. All right. All right. So ideally, we're going to have this balloon pump over here on this side right here. The reason why you'll see is because the balloon pump is on the patient's left when you get to the 429. See, it's kind of not a fast process. All right. Making sure the line management is super important. So someone needs to be holding this line at all times. This is kind of your lifeline. And one thing to remember is that most of the time, these patients are pretty stable once they're on the balloon pump. Now, the biggest problem that we have is not necessarily the management of the patient in this moment. It's the management of the lines and the management of the pump itself. So once we have the patient in, we have our vent, everything like this, monitors here. We're going to kind of just slowly go in and lift up. I'm going to make sure that this balloon pump comes up like this. We're going to kind of load from here.
Okay, you ready?
Yep. So watching the line the entire time, making sure all of that is. And as you can see, this is why it's important to sometimes have like a third person. All right, we're taking care of it. I'm going to go ahead and lift this balloon pump.
Jay, they get the, somebody needs to go around front, but just wonder.
All right.
I got the balloon pump.
All right, if you've got the balloon pump, I'm going to grab the vent. So as you can see, it's a pretty tight fit with the balloon pump and the mount. So we're going to pop the ventilator off, making sure it doesn't come off on the patient. We're going to put this up here so that it's mount like it's supposed to. And then I'm going to come around here, back around, and see if I can get the balloon pump lifted. It's another reason why it's important to have a third person so that they can help you lift this. It's not super heavy, but it's not light. Lift this up right like this. That flaps down. More down like that. Just like this. Next thing I'm going to do is go back inside. As you can see, it's not an easy process. Right, Riley's going to start for it. Let's just help you lift up and over, watching the lines. So, there we go. Make sure the balloon pump is seated down here. You can tell because it's right on this edge. You're going to lift this little latch right here. It's going to come up. You might have to move the balloon pump back a little bit, and you're going to screw down to basically tighten it in. And at that point, you can kind of shake it, making sure that it's good. And then another thing you can do is there's 2 handles on the bottom, one on this side, one on the other side. Pull those handles. This pops off, and you can actually take this around, please. Take this around to the front and use this here and watch it. Okay, next we're going to talk about in the event you have either a longer flight or let's just say you popped off this front tubing right here, popped off several times while you were trying to unload and load. It happens to all of us. We're going to talk about how to refill the helium in flight. So what you're going to need to do is make sure that you have an extra helium here. Right? It's already got the connector on it. And this is why I said it's really important to make sure that you have your helium with you, because if you are going along, that balloon is only driven by helium, and that's it. So we're going to take this right here, and we're going to show you how to refill in flight. Try to stay out of the way of the camera. All right, we're going to slide back here, come over here on the back. We're going to pop that on, and we're going to push it. And you'll show it. It'll start to fill up. You'll look at the front part of your monitor. It'll start showing that the helium is filling up. Once that's full, you just basically push this button here on the top, pop it off, and you're good to go. All right, so now we're going to talk about Impella. So we have an Impella here. We borrowed it from the cath lab here at Methodist Dallas. There are some limitations as to what we're going to be able to show you, just simply because we don't have a demo mode necessarily on this Impella, and we don't have it hooked up to the patient. We do have the drive line here simulated over to this patient right here, but we don't have an actual patient and the actual Impella portion of it, because that's the part that's super expensive. All right, so what I wanted to show you a little bit is the Buttonology. So it's really pretty easy. The biggest problem that a lot of people have is knowing where do I push to turn the stupid thing on. It's pretty easy. If you look right here, there's a little thing called power button. Follow that around to the side, and there's a little button that you push, and that pushes it in and out. On the other side, you have a thing called door release. We'll talk about that in a minute, but that's for the purge fluid that goes through. We have some purge fluid hanging. We did have an extra cassette, so I can at least show you what that looks like. But what I want to show you is a little bit of the Buttonology. On the Impella, different than the balloon pump, you're going to have a couple of different buttons, and then you have a knob to twist. So what you'll do is it's very similar to like the Hamilton. So when you have a, let's say you go into the menu, you can go into any different parts of that menu by scrolling and then hit to click. You'll notice on everything that happens with an Impella, it's going to give you menus, and it's going to give you and basically walk you through what's going on. So if you have a problem, let's say you have air in line, it'll show you how to purge the air in the line. If you have the purge fluid is going down, it'll show you how to do that. You just follow the menu. So on this one, let's say we were just starting a new case. It's going to say spike a dextrose bag. Talk about D5W, it'll just kind of go through. So if you hit next, it'll tell you close the purge cassette door, which is this right here, connect the Impella controller, push firmly, secure. So you can see how all of the menus, what happens is whenever it tells you to do things, it's going to show you exactly how to do it. Now, we can't go much farther than this just simply because we don't have anything connected up to it. But I wanted to show you basically what ends up happening here. So I'm going to go ahead and hit cancel. I'm going to hit yes for canceling yes. And then we stop. So menu is here. Again, you're going to control here. If we had this thing hooked up, another couple of things to think about is if we had this thing hooked up to AC power, it would show a battery appear, or it would show us a thing, but now it's showing AC power disconnected. That just goes to show you that you are on battery power. All right. It's going to talk about it's going to say controller is running on battery power. So not only is it going to give you an indicator, it's going to kind of tell you. Everything is pretty simple when it comes to the Impella. So whenever if you were in these alarms, let's say you went to settings and service. Let's say you go to different languages, screen brightness, service, disable purge flow, all those different things. You can do all different kinds of things going through here. So you can hit cancel, and everything you have, you can cancel out of it. So when it comes around here, I'm going to walk around to this other side. Right here, when I talked about it earlier, you had so here you have, when I talked about earlier, the door release. When you push that door, it just pops open this door release. This is your purge cassette. This is how it goes inside. So if you have a purge cassette, and we'll talk about what all of this means and why the Impella has it, you're going to, basically, this thing pops out. You're going to replace it. You're going to follow the steps on the screen. It's going to tell you exactly what to do, when to do it. You're going to pop this back in. Then you're going to push this in like this. It sits in this little spot right here. It has a little circle. Push this forward, and then you would follow the instructions the entire way. Has a little spot right here. Even has you how to tell which way it's supposed to go, which way it's supposed to go in. So there's a lot of different ways that it's kind of showing you how to do things. If in the event none of this makes sense to you, you can always call a 24-hour emergency hotline. It's printed right here. So you can call them and say, hey, I'm having a problem with this Impella. Can you help me? This is what's going on. Hopefully it's not during transport or anything like that. But once again, all else fails, you do have an emergency number that you can call. It's 24/7. They will answer the phone. They will show you how to do whatever needs to be done. These are, Impella reps, and they're Impella service providers, so they know exactly what to do. So we're going to close that, and then we're going to come back around. So I'm going to come back around here. Good. All right. So let's talk a little bit about what this controller is doing. So a couple of different lines that you have to worry about, and that's it. So we're talking about the balloon pump. You have to worry about all the EKG lines. You have to worry about the fiber optic line potentially if it has it. You have to worry about an ART line if they have an ART line hooked up to it. You have to worry about all the different cables. So on the Impella, you only have to worry traditionally about 2 lines. One is going to be one of the most important lines. This is called your drive line. If anybody's ever seen a LVAD and they have the drive line that's sticking out of them, it's white, it's hooked into a controller. This is very, very similar to that. So this is your drive line. It runs the actual pump that's implanted in the body. And then you have your purge line. And your purge line has the purge fluid in it, which they say is typically they want D5W. There's all different types of fluids. We're not going to go into too much of that because that's just too much to worry about. Basically, you're going to have the purge fluid as to what they have set. So you're just going to pick that up. You're going to do that. Now, just like in the balloon pump, you're going to have some documentation, right? So you want to make sure that you're looking at the insertion site. Same thing. Anytime anything is implanted in the body, you want to look and see where it's inserted at, what that site looks like. Is it bleeding? Is it oozy? Is it covered? Can you even see it? If you can't see it, you need to document it. One of the things that you can do is making sure that you note where the insertion site is, what centimeter it is, what the depth is, those types of things. One of the things that we've had a little bit of concern about with Impella sometimes is migration. And migration meaning that it goes, it either pushes too far forward or it pulls too far back. Once that happens, then it starts to not work the way that it's supposed to, and it'll give you lots of different alarms. We'll talk about those alarms here in just a minute. So if you're wondering how an Impella works, let's go through just a little bit about what the Impella does. So what you're going to have is, I'm just going to imagine your left ventricle. So you have your left ventricle here. You have your aortic valve on top of your left ventricle. Then you have your aorta that comes off. You have your 3 branches right here of your aorta. And it goes down like this, right? So this is just the left ventricle. The rest of the heart is over here. All right. So what the Impella does is they insert it in and it goes retrograde. So it goes up through the aorta, comes down in through the aortic valve, and stops somewhere in the left ventricle. So when this Impella comes in, what's going to happen is at the very, very bottom of the Impella, you have a hole where it pulls in the blood. Up here past the aortic valve, you have a motor that is basically sucking from all the way inside the left ventricle up to the aorta and out. The significance of this is offloading the left ventricle. So in the balloon pump where they say sometimes it's helping offload the ventricle, it's really not. It's more increasing coronary artery perfusion. This one is actually offloading the left ventricle. So if you have a left ventricle that's failing or one that's not pumping very well, a very poor ejection fraction, then you can put in an Impella. It can go in here, suck the blood through here, and then put up all the way in here. The big thing about the purge fluid is that it shoots purge fluid out here before the motor so that as it's pushing the blood out, it's basically keeping it from clotting. So that's really why the purge fluid's there. Purge fluid's very important. You don't ever let an Impella run dry, and just follow the prompts as it says kind of what's going on. Now, some of the alarms that we can get. Alarms we can get are suction alarms, positioning alarms, different types of alarms. Well, because this Impella is a pump, the pump is preload dependent, afterload resistant, just like any other pump. So it requires a certain amount of preload, and then it also is pushing against a certain amount of afterload. So think about it this way. If there's not enough preload in here, and now this ventricle, as it's pumping, because we're not taking the ventricle and making it bigger, We're just offloading what's going on in the ventricle. So let's say there's not enough fluid, and now this left ventricle is now collapsing down onto that pump. You can imagine that if this straw gets sucked up against the wall here, that's where you're going to get a suction alarm, right? Because if it's pushing up against the wall, it's literally sucking up against the wall of the ventricle, and you get a suction alarm. One thing you can do is check their fluid status. Make sure they have fluid. Another thing you can do is check the P level on there. Maybe you have a P level that's pretty strong. Now, we're going to go with whatever P level they have. I'll give you a couple little tricks that we used to use in the ICU that would help get us through a suction alarm event, at least through to keep the pump running. So if this ventricle is collapsing, you could get a suction alarm. If this pump then comes up and starts to migrate, so what I mean by migrate is down here, it starts to pull back, right? And now we end up with the pump here, and the end of the pump is here, and the suction is there. Then now we're going to end up with it sucking from the aorta and basically putting out the aorta. We need to have the end of the straw in across the valve. Now, some people tend to ask, well, what about the valve? Does it hurt the valve? No, it doesn't. The valve is just a leaflet valve that closes over the top of it and closes. The other, train of thought is to think, well, if they didn't have it, they wouldn't survive very much anyway. Now that we understand how the Impella works, we can understand kind of what's going on with the Impella. So a couple of different things that we need to think about when it comes to transport. And I'm just going to write these on here so it makes it easier for what happens. Some people ask, can we do CPR? I'm sure most of us are saying, yes, we can. We can do CPR with an Impella. The next thing is, well, what do we do if we have CPR? Well, first thing you do is you go to this handy machine, you hit the menu, it'll have the P levels up here. We can't really show you. We'll show you a graphic of it, of what it actually looks like. But the P levels here, hit P level, turn it all the way down to P2, hit the button, and now you're in P2. Now, P2 is kind of like the standby mode for Impellas. The big thing to remember about the Impella is it's a motor, right? And what don't we want the motor to do? We don't want it to clot. If there's something wrong with the patient and we have to turn the Impella down and we need to turn it basically kind of off, but more like in standby, we want to keep that Impella motor running so that it doesn't clot off, because Lord knows we don't want to have to stick another Impella in if this patient's already crashing on us. So we turn it down to P2 right here, and we treat the patient, right? Okay, so what happens if our Impella is having problems and we have a malfunction? What do we do if we have a malfunction? The pump's not working, the Impella's not working. It seems like everything we're doing is having a problem. What do we do? Well, pretty simple. We turn it down to P2 and we treat the patient. The thing we have to remember about Impellas and any other type of circulatory assist devices is this device itself is there to help assist, but sometimes if it's malfunctioning, we just have to treat the patient accordingly. Now that might mean we have to add more pressure, we might need to get more vasopressors, we might need to add more fluid, whatever is going on with the patient and that patient's condition. But P2 is pretty much going to be your friend. Now, one of the other things that can happen is, let's say you have a suction alarm, right? So during transport, you start having suction alarms. What are the things you can do is if you think it's fluid dependent, you think they're super dry. Some of the ways that you can tell that they're super dry is, let's say their blood pressures are going way up and down, up and down. You can also tell on the Impella if they're losing a little bit of pulsatility in the motor current. It's kind of hard. I'll describe that here in just a second. But you want to see if they've got enough fluid. Sometimes it can be just as simply as going down one level. So let's say you were at P6 and you go down to P5, right? So you go down one level, P6 to P5. See if that suction alarm, now I'm just using these randomly, let's see if that suction alarm goes away. If it does, turn it back up to P6 and see where you're at. could be that it's just that during transport, remember that picture I showed you just a minute ago that had the ventricle and that straw? Maybe just in transport, you move them a certain way and that failing left ventricle kind of fell up against the edge of that. And now it's sucking up against the wall. Sometimes it's just a matter of turning the P level down, kind of breaking that suction, turning it back up, and you're good to go. All right. So the other thing that can happen with your consoles is you lose pulsatility, right? And the reason why we lose sometimes pulsatility is, let's say we have a failing left ventricle, because the Impella, like I said, it's an assist device. It's not running the heart for you, so your ventricle is still pumping. It's just inside the ventricle, helping that ventricle offload. So let's say all of a sudden now you've got a point where you've got the motor current or something's going on, you lose pulsatility. There's a difference. And when I say by pulsatility is, we'll show the graphic up here, but there's usually a red line that runs across. There's a white line that talks about LV, the left ventricular pressures, and then there's the motor current line that's at the bottom. That can tell you that now that left ventricle is failing a lot. Or also, it could tell you that the motor current, when you watch the motor current, it can also mean that something's going on. Is there a clot somewhere? Is there something going on? So it's something that we watch for. One of the things I'm going to draw you real quick, a motor current line, and I wish I had a green marker, but you're going to have your motor current going along. Now, the pump is running, your pump is running at a specific rate, right? So it's a specific setting, P6. It doesn't go P6, P5, P6, P5, P6, P4. It's just running, let's say if it's set at P6, at P6. As the ventricle is collapsing and opening, it's causing different pressure gradients. And as that's different pressure gradients, it's causing the motor current to either work harder or not as hard, depending on the pressures that it's having to push against or pull against, right? So that's why when you look at your motor current, you can tell if your pulsatility is going down, because if all of a sudden you're going like this, which it should look like a fairly jagged line, right? Some people describe it as a very, very, very fine V-fib, but really it's just variability in a line. If you go from that to all of a sudden now it's going like this, then you've lost pulsatility. You need to make sure you check the monitor, you need to start checking the patient, and you need to start kind of considering what the cause is of that loss of pulsatility. Later on, we're going to talk a little bit about Impellas. We're going to talk a little bit about transport considerations for Impellas. We're going to talk a little bit about what's going on when we load them into the 429, how we go about doing that, everything like that. But remember, Impellas, P2. P2 is your friend. All right? All else fails, CPR, turn down to P2. Suction alarms, turn it down, not necessarily to P2, but back up. Malfunction on the device, it's just not working, can't get it to work, it's malfunctioning, something's going on, turn it down to P2. Treat the patient like we know how to treat them. All right, so once again, we're back up on the helipad up here at Methodist Dallas, and it's kind of windy up here. We're going to talk about the Impella now. We've already talked about the balloon pump and loading it in, so we're not going to go over the line management or anything like that. Just know that that's just as important in the Impella. The Impella is an implanted device. On this one, we have simulated that they have a 5.5, which means it goes up. The 5.5 is typically going to go up here. And so we've simulated that with this cord here, which is the drive line. We've already gone over all the different pieces of the Impella, so we're not going to have to do that. Now we're going to talk a little bit about some of the logistics inside with the mounts and how it fits with the vent and everything on the wall. All right, so let's talk a little bit about what's going on with the Impella. Once we move, I'm going to move it just a little bit more. If you'll move in just a little bit more so I can show what's going on here. Once we get to a point where we can slide the Impella in, the Impella goes into the mount like this. So it goes in from the side. Obviously, there's a stop right here, so it's going to come in from your right to your left. So if you can see right here, what's in the way? The vent. So the vent mount has to come off in order for you to slide the Impella in. So what ends up happening is you either have to take the vent mount off or you have to take the Impella mount off. So on the Impella mount, there's a little button down at the bottom. You can pull up and pull the Impella mount off. All right, so the easier way to do it is to have someone who's holding the mount steady while I manipulate the Impella, because it's kind of hard to get it into that one spot first. Here's another thing to remember. This right here, see how if you push it too far forward, it gets stuck? We're going to slide this out. This actually pushes in. So that's important. That's an important thing, because sometimes you'll get on there and then now you can slide the Impella all the way in. And then you take your little piece here and you lock it just like you would lock your vent. This allows the Impella to then just lift with this circle right here up onto that thing right there. Slide down till it clicks, making sure that it's in there. Okay, now it's in, and then we're good to go. So, in order to avoid all of this that we just did, take the Impella, put it on the mount, then all you have to do is slide it in and pop it over the top. Some people actually even take it into the hospital with them, put it on the mount there, bring it out, click it on the wall.